Hi, I'm Gary Bebow, CEO of White River Health System, and this is a November CEO Connection. I want to talk a little bit about some of the things coming up at the hospital. You know, I've mentioned earlier about having our own helicopter service at White River Health System, and December 1st is the date that we believe it will be up and operational. You know, as we start looking at viewing ourselves as more of a regional provider of healthcare services, whether it's more timely transport of patients from our medical complex in the Highland area, or transport from Stone County Medical Center into Batesville, or from Batesville or White River Medical Center to other hospitals in Little Rock, helicopter service will be a great addition to our services. I wanted to talk a little bit about ACE training. We have a team that's putting together one of the best ACE training programs I think we will have had. Last week I saw part of that program and interacted with the folks that are putting it on, headed by Toy McMullen and the remainder of the staff. I think you're really going to benefit from the programs this next year. So I think the schedules are out right now for signing up to participate, and get signed up and come and look forward to the benefits of that ACE training. So I'll see you there. This month's community education is on November 11th in the Josephine Ray Rogers Conference Center at noon. The program this month will be headed up by Dr. Shannon Swift, and she'll be talking about the importance of monitoring blood pressure. And so I know that we'll benefit from hearing Dr. Swift speak. Following Dr. Swift, we're going to hear from Dr. Doug Bernard, who's going to talk as a CMO our preparedness for Ebola. In the event that should ever occur here at White River Medical Center. I'm really proud of the work that our leadership team has done in preparing us for that possible infection at our hospital. You know, almost on a daily basis, we're getting updates from the CDC on how to best prepare for and how to best treat Ebola in the event that it should come here. While we don't think the probability of that ever occurring at White River Medical Center is very high, I think it's really prudent for us to be prepared just in case that should ever occur. So, you know, Tammy Gavin, Dr. Bernard, Dee Dee Strecker, Kathy Thomas, and a host of other people have really done us a great service in preparing ourselves for Ebola in our policies and practices. So if you see them, give them a pat on the back. On October 14th, we conducted our Health First community event along with the cooperation with First Community Bank. Over 400 women attended the event, and based on all accounts, it was really a great success and very meaningful to those who attended. So many volunteers made it happen, and for those of you who did volunteer, hey, thanks a lot. I think it really makes a difference as we view our mission from a more of a community perspective, that we do these types of things, and it only works out if we have a whole bunch of us involved in it. I went out that day and participated, and I can tell you the people that were there really benefited from it, and so thanks for your involvement in making it a success. One other event that's coming up this month in November is on November 18th. We're having an open house at our Drasco Clinic, where Kathleen Maples will be introduced to the folks in that area, and just, you know, for us to showcase the services we provide there. If you happen to be in the Drasco area at that time, drop by and congratulate that staff for doing a great job providing healthcare services to that area. This concludes my CEO Connection for November. As in the past, if you have any suggestions or comments on where I can do a better job, please forward those to me. You know, following last month, I talked about revenue cycle, and I talked about reducing costs and reducing length of stay and improving quality. You know, I've had a lot of feedback from staff regarding those initiatives, and it's really important that all of us keep that front of mind. And so to the extent that you have further thoughts, pass them along and give us the benefit of those ideas, but importantly, give us a benefit of your active involvement in helping us achieve those initiatives. So thanks a lot. We'll see you next month.